there is a new drug on the market that will help cure hepatitis C, which of course is great news because for a very long time it's been very difficult to cure it. It is a liver disease and it affects more people than HIV does. In fact, let me give you some numbers. Hepatitis C impacts about 3 million Americans and also 170 million worldwide. When it comes to HIV, it's 1.1 million Americans and 34 million globally. So obviously both are very serious, but more are victims of hepatitis C. So thankfully there is a new drug on the market that can help cure it. It's known as Sovaldi, and it costs about $1,000 per pill. And if you're wondering how long you need to be on this treatment in order to get cured, it's about 12 weeks for the program, and it runs the average user about $84,000. So the reason why this is being covered by the press right now is because some are questioning whether or not this is a fair price for something that is supposed to cure a terrible disease, right? And there has been some analysis of this, and the analysis indicates that if you want to produce the drug, it's about $150 to $250 per person. Right?
Yeah. To produce the drug?
To produce the drug. Why do you need to charge $1,000 per pill?
I'm going to play devil's advocate for a second, and because I have major problems with the kind of pharmaceutical medical industrial complex in this country, and I hate that we have a for-profit medical system. I think it's highly immoral. But aside from that, being the case that we do have a for-profit medical system in this country, yes, that is the cost of production of the drug, but what's the factor here of R&D on this drug? How long did it take to develop? How many people have to be paid? How much money was funneled in to coming up with this treatment? And a lot of times what happens is that one kind of hallmark drug for a drug company, for a pharmaceutical company, has to pay for development of other drugs that they also do. So I think sometimes it's a little more complicated than just this is how much it costs to produce, this is how much they should sell it for in order to get a good profit. That being said, is this a fair profit? I don't know, because this seems like significantly higher.
It seems very excessive, and I like that you pointed all that out, Kara, because there are some details that I should mention to the audience. So for instance, Gilead Sciences Inc., that is the pharmaceutical company that produces this drug, they actually acquired another company that began the research on it, and they spent about $11 billion on that, right? So the argument would be, well, you know what, they need to get a return on their investment, and they need to turn a profit. Let's keep it real. We have a profit motive here, and they want to make some money off of it. But even considering that, all they would need is about 150,000 people to purchase their drug in order to already make up for that investment. Anything above that is now going to be a profit, right? So let's take that into consideration and bring the cost down. However, after the vice president of this pharmaceutical company talked to the press and that suggestion was offered to him, he basically said, yeah, we're unlikely to do that. We might help some Americans when it comes to the cost, but we're looking to make some money here.
And they know that they're only going to make money in an American market because, truth be told, this is a horrible epidemic in America. It's an even worse epidemic globally. They know they can't make that kind of money in a global market. They have to charge less money once they start selling this drug to people in second and third world and developing nations. And so America is going to be the market where they have to recoup their investment, unfortunately. Now, that being said, most Americans in this country now have access to affordable health care. And so I wonder how much their health insurance is going to play into this conversation. They've got to be able to get access even if they have a pre-existing condition like hepatitis C.
Definitely.
So is this drug going to be covered by their health plan? Let's hope so.
Yeah, it's always interesting to see the specifics of the Affordable Care Act and how it will impact certain cases like this. But another thing to take into consideration is that some people do not need, some people need more than 12 weeks of treatment. Some people need double the treatment in order to cure the condition. So, all right, I mean, how can you imagine even spending more than $84,000 on curing yourself from hepatitis C? That's inconceivable. I mean, if someone came to me and said, you need that money to cure yourself from something that will eventually kill you, I just can't come up with that kind of money.
Guess I've got hepatitis C now.
Yeah.
But here's another interesting counterpoint there, which again, not a moral argument on my point, on my side, but I think it's an important point to make. Until this drug was developed, there was no cure for hepatitis C. There were only treatments. There were only things that would keep the disease at bay.
And they had horrible side effects.
They had horrible
as well.
side effects, and a lifetime of those treatments, late phase treatments, was going to run you significantly more than $84,000. So this actually could save the average person who has hepatitis C money.
So wait a minute. So this is a definite cure for hepatitis C?
Hepatitis C.
No kidding.
Yeah. I mean,
No
that's
kidding.
amazing, right? So would you pay $84,000 to cure your Hep C? If
this
you
is for real.
This is for real.
So really fast, one point that I want to make. So you gave like the most reasonable example of the calculus that goes into, well, we spent a lot of money to develop it. We need to make our money back. You were totally reasonable. Some people, I think, on the right would go a step farther and sort of, with I guess an Atlas Shrugged sort of point of view, like how dare you even discuss how much they should be allowed to price it? As if like, well, you know, this is a free market, we're competing and they came up with the good drugs, so they get to charge whatever they want. But the problem is that the market is not free at all because they're going to have a protected patent on this for as far out into the future as you can see. And even right now in the TPP negotiations that are going on right now, one big part of it is increasing the duration of medical patents. So you can't on the one hand say, we developed it in a free market and so we should be able to charge whatever we want, and then say there will be no competition from generic substitutes for this for 17, 20, even longer years. You can't have it both ways.
But apparently you can, because
that's the unfortunate thing, yes.
that is the market that they see. And this is my main problem. This is my biggest problem with a for-profit healthcare system. Healthcare, I think, is an unalienable right. I think that healthcare is something that I have a very strong socialist view when it comes to healthcare, and I'm not afraid to say that. I think that we should have a single-payer option in this country, and I think that everybody should be able to have access to affordable healthcare, because you cannot control why somebody gets sick and why somebody else doesn't. It has absolutely nothing to do with any sort of market, ebbs and flows. And the real danger here is that when you have a free market system surrounding healthcare, you're incentivized to keep people sick.
Absolutely.
That's such a damaging system that we have in this country.
I mean, are there any success stories of socialized medicine? This is what, I mean, can you point anywhere else in the world where people have a better outcome medically?
Where's the map?
Every country?
Every single developed
weird.
nation.
That's
right?
really
every,
weird.
No,
Every developed nation.
But they have to wait a little while. Yeah, no, they do. That's totally true.
And
So
we
conservative will say in Canada, you have to
don't.
wait longer to get your treatment, which is true. You ask them and they say, yeah, it sucks, you have to wait. And then you ask them a follow-up question which doesn't get reported, would you prefer to go to the American style? And they're like, fuck no, I'd rather
No.
wait for a little while.
Also, did you know that we are the only developed nation in the world where it's legal to market drugs directly to the
Pharmaceutical drugs.
consumer?
Yep.
Yes.
Because it's immoral.
Yes.
Why do you think it's outlawed everywhere else in the world? Because it's highly immoral.
Ask your doctor about whatever anti-anxiety, anti-depression drug that we're offering you right now.
And
You have
as-
access to WebMD. You know better than he does.
Exactly.
Ask him about all sorts of expensive
And
shit.
I have to quote him, as Bill Maher once said, which I think is one of the most brilliant quotes that he's ever said. When, and I'm not going to say it verbatim, but once you are asking your doctor for drugs instead of him telling you which drugs you should take, he's no longer your doctor, he is now your dealer.
Definitely.
That's
It's
a
so
great
true.
point. Yes, that is true. Yeah, in fact, but sometimes they will give it to you. So that's nice.